There are two forms of esophageal cancer, adenocarcinoma and squamous cell carcinoma. And adenocarcinoma is the one that is most linked with gastroesophageal reflux disease, which is the abnormal movement of fluid from the stomach into the esophagus, where it causes chronic irritation and genetic changes that ultimately lead to cancer. The squamous cell carcinoma is a form of cancer of the esophagus that's most commonly related to the use of tobacco products and alcohol. Chronic symptoms that really don't resolve, like gastroesophageal reflux disease, weight loss for some unknown reason, the coughing up of blood. Those are what we call alarm symptoms. And anytime you have an alarm symptom, that should be checked out right away. One of the biggest problems with esophageal cancer is that as the cancer grows, it envelops the entire circumference of the esophagus. And what was once a distensible organ now has a napkin ring around the end of it. So unfortunately, most commonly, patients present with difficulty swallowing. And when one has difficulty swallowing, usually the cancer is more advanced. When a diagnosis of esophageal cancer is made, the treatment can go down several paths, and that's all predicated by clinical staging. So we try to understand how deep that tumor goes through the wall of the esophagus. Are there any lymph nodes involved? Or is there spread of the cancer to a distant site like the liver, the bone, or the brain? Once we understand what the stage of the cancer is, then usually we implement a therapy that will include radiation, chemotherapy, and a procedure called esophagectomy. And esophagectomy is the removal of the esophagus and top part of the stomach, replaced with the stomach, which has been made into a tube and brought up through the chest. And we do that through small poke incisions as well, with relatively rapid recovery in most patients. After someone has an esophagectomy or removal of the esophagus, they are usually committed to antacid medication. They most oftentimes will have a sense of early fullness after they eat. The things that people can do are to modify their diets into a healthy diet, to eliminate obesity, which is a big problem and is tightly linked with cancer, and to see their physician if they have non-specific symptoms or specific symptoms of difficulty swallowing, chronic regurgitation, or heartburn.